Hello, I'm Beth Britton. I support Dementia Community with their communications work. Welcome and thank you for joining us for our second March webinar. Before we get into the topic for today, I wanted to briefly explain a little bit more about Dementia Community. Dementia Community is a charitable community benefit society, a membership cooperative that provides learning and networking opportunities for the dementia care community. We are an independent voice and inclusive organisation aiming to help all of our members to feel connected, informed, inspired, empowered, purposeful and engaged in co-produced changes that improve everyone's experiences of dementia, both in care and in wider society. This webinar is just one example of the many ways in which we do this. Community members own a £1 community share in Dementia Community, and membership is open to everyone. So if you aren't already a member, do join us. You can use the QR code on your screen or the link in the chat to visit our membership page. If you're having any difficulties in joining Dementia Community, please do message myself or my colleague David and we will aim to help you. I'd also like to highlight a really exciting opportunity to join us in person on Tuesday, the 3rd of June at M-Shed, Bristol, for our Creative Dementia Arts for Health and Wellbeing Conference. This is a one-day event showcasing best practice in working with people living with dementia using creative arts. Please do use the QR code on the screen or the link in the chat to find out more information. We look forward to seeing you there. So on to the topic for today's webinar. Our topic today is support for people facing eating, swallowing and communication challenges. I will introduce you to our speaker shortly, but just some brief housekeeping first. We are recording this webinar, so if you don't want your face on the recording, please turn your camera off. Please use the chat for your questions. We will have a Q&A after the presentation and we will be keeping an eye on the chat. You are welcome to also have some live participation. If you would like to ask a question in person, do let us know and we will hopefully get to your questions at the end of the presentation. Afterwards, my colleague David will email you the slides and the recording will also go onto our YouTube channel, Dementia Community, so do look out for that. We will also send you a feedback form. There will also be a link in the chat for that, and we'd be really grateful if you could complete it. So let's get started. So our speaker for today is Dr. Lindsey Collins, Associate Professor, Lead Dementia Care Consultant and Trainer, Centre for Applied Dementia Studies, University of Bradford, and Royal College of Speech and Language Therapists, National Clinical Advisor on Dementia and Dysphagia. That's a very long title, Lindsey, but it's a fabulous title, very befitting of your expertise in this area. We're so grateful that you've joined us. Thank you, and over to you.
Thank you so much, Beth, and thank you for the invitation to come along today. It's a topic that's really close to my heart, something I'm very passionate about, and I'm excited to be able to share with you a few hints and tips and some information about eating and drinking and also about communication. I'm just going to pop my slides up. We checked earlier, so hopefully those are all working. As Beth said, I'm going to talk to you today about two similar topics that I can say that as a speech and language therapist, so eating and drinking and communication. We group those together because speech and language therapists support people both with eating, drinking and swallowing difficulties and also with communication difficulties. So that's why those two topics are grouped together. So the information that I'm going to share with you today, I'm sharing really on behalf of quite a large group of people. So the information is going to come from some guidance that was developed in 2024 or published in 2024 by the Royal College of Speech and Language Therapists. And this was some updated guidance for members of the public, and we also created some guidance for speech therapists and commissioners of speech therapy services. Develop some updated guidance around how we might support people living with dementia. And really today I'm going to be presenting a bit of a highlight of this information, but you can access the information in full yourself. So on the slide here, there is a QR code that you can scan if you are technologically inclined to do so. There's also a link at the bottom of the slide there, and it will be shared in the details of the YouTube recording as well. So there will be a link you can click on in the notes there also. So the aim of the guidance that we developed, and I'm just going to talk about the public kind of guidance, was to provide clear, evidence-informed information so that members of the public can understand more about speech, language and communication and eating, drinking and swallowing in dementia, and to provide links to some other resources that might be useful. Now, I was really privileged to be asked to be the lead author for this information, but I certainly can't take the credit for all of the guidance. So it was developed alongside 10 supporting authors. So these are expert speech and language therapists working in the field of dementia. And also we had a project reference group of about 24 people, and this included 6 people with lived experience of dementia. So we had 4 individuals who had a diagnosis of dementia that supported the guidance development, and then 2 family carers as well. In addition to this, the guidance, once it was drafted, went out to a large stakeholder group who provided some really helpful, invaluable information about their experiences as well. So it was a huge project, but I'm absolutely delighted to be able to share with you today the highlights of this guidance, and really do encourage you to have a look at it in full as well. So this is what is covered in the dementia guidance on that link that I just shared. So there's some information about what dementia is. There's a specific section on primary progressive aphasia, which is a specific type of dementia that affects speech, language and communication. So we've got a section specifically on primary progressive aphasia. We've got a section on eating, drinking and swallowing, one on speech, language and communication. And then there's a section on the role of the speech and language therapist, and a really detailed further resources section as well. For today, because I have a short period of time, I'm just going to focus on some of the key bits of information around eating, drinking and swallowing. And then I'm going to talk a little bit as well about speech, language and communication. So I hope you're going to go away from this session knowing a bit more about the kinds of challenges that people living with dementia might experience in these 2 areas, but also have some hints and tips as well, some general strategies and advice that might help you if you yourself have some of these difficulties, or if you're supporting somebody who does. So I'm going to start by talking about eating and drinking. This is a very important topic for me because of my profession. I also love to eat. So it's also personally something I can see Beth's having a little snack as well whilst we're talking, because eating and drinking is such a core part. Please carry on, Beth. Don't stop because I've highlighted it. It's such an important topic because it's so relevant to all of us in our day-to-day lives. So we do eat and drink for many, many different reasons. The physical sustenance is really key. We have to eat and drink to stay alive. It's something that we have to do to fuel our bodies. But it's not just about that, because if it was just about physical sustenance, we'd be perfectly happy to eat the same bland food every single day. Or glasses of water for all of our drinks. We wouldn't be bothered about anything else if it was literally just for physical sustenance. But it's about so much more than that. It's about the social interactions while we're having something to eat. So going out for a cup of tea and a cake with a friend, or sharing a meal during a religious event or a social occasion, a birthday or a celebration. It's also about comfort. So food and drink that provides us with comfort is more meaningful to us. So my nana used to make the best apple pie and custard in the world. There was definite comfort that came from that, and a heck of a lot of calories as well. But it's such an important thing to think about those comfort needs, the comfort food that we will have, sharing things with other people, and then just the pleasure and enjoyment we get from a really nice food, type of food, or a perfect temperature cup of tea, that's made exactly how we like it, that there's something really pleasurable about that. So it's important that we remember these reasons why we eat and drink. It isn't enough just to think about getting food and drink into ourselves. And we often hear about food and drink being called nutrition and hydration, and it really medicalizes it, when actually eating and drinking is more than that. So I just wanted to put that in our minds for when we're thinking about why this is an important topic. Now, in order to eat and drink, we need lots of different things, but particularly we need a swallowing mechanism. So we need the muscles and the nerves in our throats to work so that we can swallow things. And we often don't think about this because we do it so naturally, day in, day out, whether we're eating and drinking or just swallowing our saliva. We swallow so many times throughout a day and throughout the night, but we often don't think about it because we do it automatically. So I just wanted to share with you a little video which shows us what we'd call a normal swallow, a non-impaired swallow might look like. So on the left-hand side, there's a little picture which is there to kind of orientate us. So the person is facing to the side and we're seeing a cross section. And on the right, I'm going to show you a video which is of a video fluoroscopy, which is an X-ray of someone swallowing something. So you'll see that they're facing to the side, so you can see their nose is going to be pointing the same way as that picture, and their throat at the front is a tube that goes down to our lungs, and at the back there's a tube that goes down into our stomachs. So I'm going to play this video and show you what a non-impaired swallow might look like. So we can see the person is chewing the food, so we can see that movement, and then they swallow and it pushes that bolus, the food, to the back of the throat. It's going to be on repeat. So it pushes it to the back and it goes down, it closes off the airway and goes down the pipe at the back, down into the person's stomach, which is exactly what we want it to do. And there's a little bit of residue, there's a little bit left. They do a second swallow and that clears what is in their mouth. So if I saw this person in a clinic, I wouldn't be worried. I think that is a perfectly normal swallow. That seems absolutely fine. On the next video, the same orientation, so the person's facing the same way. This is an example of what we might call a disordered or an impaired swallow. So this is with a drink, and we can see that there's a lot more of that fluid hanging around. We can see that it goes, so the first swallow is coming up here. Then the second swallow doesn't come until that liquid has pooled quite a lot in that person's throat. And what you can also see is a little trickle down the front of the person. It looks like it's down the front of their neck. It's actually inside that pipe that goes down into the lungs. So that's what we'd call aspiration. That's when we talk about the food or the drink going the wrong way, going down into that person's lungs. And it all looks a little bit more messy. It doesn't look as coordinated, and looks a little bit more effortful when we're seeing that that person swallowing. So that's what we'd call an impaired swallow. So it's sometimes helpful just to remind ourselves how complicated this process is. And there's lots of different muscles and nerves involved in this process. I'm going to skip on. I know sometimes people feel a little bit queasy thinking about what's going on inside them. So I'll skip on to talk about then some of the causes of eating and drinking challenges or difficulties. So one of the things that can go wrong is those muscles or the nerves don't work quite as well. So we see changes in muscle strength, movement and coordination. And because these things are controlled by the brain, if someone has a diagnosis of something like dementia, something that affects the way in which the brain works, then that can impact those muscles being as strong or moving in a nice coordinated way. And that can then cause problems with swallowing. But actually, there's a lot more things that can go wrong with eating and drinking as well. So not just the swallowing, but that bigger picture of eating and drinking. So things like someone might have problems recognizing or using cutlery. So recognizing it on the table or picking it up and being able to use that cutlery. It might be that the environment could cause challenges. So sometimes if the environment is very busy, either visually, so lots of clutter around, or it might be very noisy or might feel quite hurried, that can also cause people to have problems with eating and drinking. Sometimes someone might not like the texture or the taste of a certain food. And certainly for some people with dementia, as that dementia progresses, this can become more of an issue for that person. So their sensory feedback might change, and it might be that certain foods don't taste the same, or food might feel not very nice in that person's mouth. So the lumps might stand out as well. So sometimes that texture and taste can be a problem. For some people with dementia, they might forget that they had something to eat and drink, so might still want to eat and drink more, or might think I've just eaten when actually it was 2 or 3 hours ago when you last ate. So it might be that that timeline isn't quite as clear. If people are poorly, so if you've got an infection that's causing you to feel a bit more confused, if you're experiencing pain, so whether that's pain in your mouth or in another part of your body, that can also affect our eating and drinking. Not being aware of hunger or thirst, so that feedback to our brain not being there. And I know in the presentation earlier this month around continence, that was also talked about, that awareness of our kind of bodily awareness of our bodily needs might not always be fed back to the brain. So that can be true as well in terms of hunger and thirst. There can be sensory changes. So it might be that when someone puts food in their mouths, that feedback isn't going from the mouth to the brain to say that there's something there that needs to be swallowed. So that can also be a challenge. Sometimes as people's brains changes, particularly with changes to visual processing, so making sense of what we see, it can become more difficult to distinguish between things that are edible and things that aren't edible. So someone might put something in their mouth that isn't actually a food item. We also need to be really aware that if we're struggling with something like eating and drinking, we can feel quite embarrassed about that. So it might be that maybe the food or drink comes out of our mouth a little bit more. It might be that we cough a little bit more and we start to feel a bit embarrassed. And so maybe some people might then not want to eat or drink in front of other people. And also another really important challenge for us to think about is that it might be that someone's preferences or cultural needs are not being met in terms of food and drink as well. So we do need to also recognise that as a cause of eating and drinking challenges. If the food or drink I'm being given doesn't fit with my preferences or doesn't fit with my cultural needs, then I may start to eat and drink less. So all of these causes we need to be really aware of, in addition to those physical changes that can happen to our swallowing as well. So some of the things that we might need to look out for that might indicate that there's a problem with eating, drinking and swallowing. So it might be that food becomes more difficult to chew, and that can be because the muscles aren't working as well. Also, sometimes if people lose weight, your dentures don't fit as well if you wear dentures, and that can make it more difficult to chew food as well. Difficulties using cutlery, so we mentioned that as one of the causes, so that can be something to look out for as well. Things not tasting the same, so feeling that things taste a bit weird, they taste a bit odd, we're not enjoying them as much. One of the common things that people often notice is coughing or choking on food and or drinks, and this can be at the time of eating and drinking, or it can be shortly afterwards as well. So we saw in that video that I showed, some of the food and drink hung around in the throat a little bit, and sometimes if someone's not aware of that, it might then go down into their lungs and cause them to cough after they've finished their meal or their drink. Food staying in the mouth after swallowing, and again we saw that with the second video, and a little bit with the first. So sometimes we do have to swallow a few times to clear what's in our mouths, but if that food is staying in the mouth, that can be an indication the swallowing isn't quite as strong. Some people might find that their mouth feels very dry, or they might feel like they're producing too much saliva. And normally that's because if we swallow less frequently, then the saliva comes out from the front of our mouth rather than going down and being swallowed. So often it's that it isn't we're producing more saliva, it's just we're not swallowing it quite as frequently or as effectively. Some people might not feel hungry or might always feel hungry, so that also can be a challenge for people. There can be issues with weight loss as well, and that's something important that we keep an eye on if someone's losing quite a lot of weight. And then also if someone's getting lots of chest infections, that can be a sign that things are going down into their lungs. So things are going down the wrong way. And really important when we talk about chest infections, that it's not generally just the food or drink going into the lungs that's the problem. It's if your mouth isn't very clean, the bacteria in your mouth can also go into your lungs with that food or drink, and that's what then can cause the infection. So one of the tips I'll come on to talk about is about mouth care, that it's really important that we think about that. Now, if you're experiencing some of these difficulties or you're supporting someone who's experiencing some of these difficulties, you might then need to see a speech and language therapist for individualised advice about eating and drinking. I am going to share some general tips, but as I say, if you're having these problems, it's always worth asking for a referral to your speech and language therapist. That could be through your GP, or it could be through, if you see a consultant, then it could be through them as well. So if you do see a speech and language therapist, some of the things that they might do in terms of eating and drinking. So we'll always have a chat with you about your preferences, about just finding out a bit about you, about why is food or drink important to you. So finding out about your lifestyle and things that would impact your eating and drinking. And then we'd ask you about any changes that you'd noticed. So what is it that's caused you to ask for us to come out and see you? What are the kinds of problems that you've been having? We generally like to observe you eating and drinking if you have problems with swallowing. And generally we would say, could we come at a meal time and just eat and drink what you normally would in your familiar environment? So that's what we want to see, is what normally things look like. So you don't have to do anything differently. We want to see normally how you get on with eating and drinking. We would also chat with families and supporters. So that might be a paid member of staff if someone lives in a care setting or is supported by home care staff, or it might be with a family member or a friend or a neighbour who might provide support as well, because we like to know what they might have noticed as well, and also what their role might be in supporting eating and drinking. And from that, we would provide personalised advice and support. So we'd give you some guidance about things that you could try that might make eating and drinking more enjoyable for you. So although we give personalised strategies, here are some general things, and these are things that feature in the guidance. These are just a few of them. There's many more strategies in the full guidance, but some things to think about. So thinking about the environment, so we might talk about trying to make the environment less distracting so you can focus on eating and drinking. Think about how you're sitting when you're eating and drinking. So laying back on the sofa or laying down in bed aren't the safest ways to eat and drink. So when you saw that video, and I talked about the tube at the front goes into our lungs, the tube at the back goes into our stomach. But what we saw is in the second video, that food and drink went back into the throat before the airway closed off. So it went down before it was ready. And if we're laid down, that food or drink will move more quickly over the back of our tongue and go down into a potentially unprotected airway. If we sit more upright, the food or drink is more likely to stay in our mouths until we're ready to swallow it and we can close that airway off. So thinking about how you're sitting and being as upright as you can is really helpful. Think about making changes to flavour and temperature. So if something is very bland, if it's very room temperature, it doesn't give our mouths much feedback to give to our brain that tells us we need to swallow. So if we have things that have varying temperature, if they have stronger flavours, we're giving more information to the brain that there's something in our mouths that we need to swallow. So we can play around with those flavours and temperatures. As I mentioned before, keeping your mouth and teeth clean are really, really important. Reducing that bacteria in your mouth means that if something goes down the wrong way, it's less likely to cause an infection because it's not going to be taking a load of bacteria down with it as well. Using your dentures if you have them and making sure that they are well fitted. Sometimes not using your dentures will actually be easier if they're really, really loose. So thinking about how you're using your dentures and also your glasses and hearing aids, because as I mentioned, eating and drinking isn't just about getting food and drink into yourself. It's also about that social aspect. And if we can't see and hear, then it makes it much more difficult to engage with our food, to enjoy our food, to recognize it, and also to interact with other people as well. If you do need help to eat and drink, agree with the person who's helping you what helps and what doesn't. It can be really, really helpful to be able to give that feedback if you're able to, about it helps me when you ask me before you give me another mouthful if I need direct support, or it helps me if you can cut up my food, but then I can eat it by myself. So being really clear about what does and what doesn't help. Sharing your preferences, and this can be done kind of ahead of when you might need it. So letting people know what your preferences are. So I'm really clear that I'm vegetarian. I'm really clear that I like my food really hot. I don't like room temperature. If it's meant to be hot, it should be hot. So I don't like just room temperature food. I like my cup of teas really hot and not strong, but not milky. So that it's having those preferences shared with people. I don't just want you cooling it down by adding a load of milk. Just a couple of squeezes of the tea bag is enough. So being really clear on what those preferences are. And if you have problems with things like cutlery, you can use your fingers, like finger foods, absolutely fine. A lot of people find things like having soup from a mug rather than using a spoon can be really helpful, really easy. And trying, you can get things like adaptive cutlery. And in the guidance, there's some links to adaptive cutlery and different tools that you can use as well. If you need direct support from someone, so this is if you yourself are struggling to eat and drink, or if you're supporting someone who needs more hands-on assistance with eating and drinking. A few little tips for you. So sitting where the person can see you, so the food or drink doesn't just come out of nowhere. Talk positively about what's on the plate. So this is particularly important if someone needs some adaptations to their food. So trying not to pull a face at it, you know, try and say, oh, this looks lovely, or this smells really delicious. Trying to speak positively about what that person is about to eat or drink. Focus fully on supporting that person. So try not to do 7 things at once, because that can add a lot of distraction. So try and be really focused on the person. Supporting the person to do what they can for themselves. So we often talk about facilitating, and facilitating is about providing the amount of support the person needs, no more, no less. So we don't want to disempower the person and do things for them, but we also don't want that person to struggle to such a point that they're going to get really frustrated or give up and then not eat and drink. So providing that support, the amount that's needed, no more, no less. Taking our time, so giving small amounts at a time. Think about how much food or drink you put in your mouth at a time. Would you have a rounded dessert spoon of food in your mouth all at once, or would you be more likely to have a smaller mouthful? So thinking about that kind of small amounts. Taking your time and giving prompts as needed and encouragement as needed as well. And if you can sit together and eat with that person, that's going to make it much more normal, because that's what we do when we share meals together. So think about that ability to share that meal with that person, or share, have a cup of tea alongside that person. Okay, and that really then links in with the social interactive element as well, and leads me on then to talk about communication. So thinking about communication, we can think about it linked to eating and drinking, because as I say, eating and drinking is a sociable occasion, but also we communicate throughout our day, all day, every day. I think my family certainly say that being a speech therapist is an ideal job for me because I love to eat and I love to talk. So it's the perfect job for me because it covers both of those things. So communication is something that's really important in our day-to-day lives. So I thought I'd start just with a little reminder about what we actually need to enable us to communicate. Because again, like eating and drinking, we do it so much that we can often forget the detail, the nuance about communicating. So we need three things in order to effectively communicate. So we need a method of communicating, so a way of communicating. We need a reason to communicate, so something to communicate about. And we also need opportunities to communicate as well. And I'm just going to talk just briefly about these before we go into some tips to help with them. So in terms of methods of communication, there are so many, and I've just chosen a few to share. The most obvious ones, perhaps, are things like speaking and writing. So they're the ones that we do quite often, certainly using text messages and WhatsApp and emails, all of those things. So those written forms of communication, we use an awful lot these days. But also things like our body language, so how relaxed or how tense we might look in our body language, our facial expressions as well. Eye contact is a method of communication, so just catching someone's eye can communicate quite a lot with that person. Sounds as well, so it doesn't necessarily have to be words, it can be the sounds that we make and the tone of those sounds. So quite often people can communicate something just with a ha, that tells us something. It's not a word, it's a sound, but we can hear that kind of, yeah, I don't quite believe that, in that, ha, yeah, right. It can give quite a lot of information, so it can just be a sound that we use. We might use signs and gestures, and they could be formal signs like sign language, but also can be other kind of more gestures that we might use to communicate. Touch is really important. This some people can feel really comfortable with, some people do not feel comfortable with touch, and so again that communicates something to us when and how we use it. Pictures, so that could be pointing to a picture or drawing a picture or using photographs, so we can use pictures to communicate. And then more creative methods, so using art and music, using those creative ways to communicate with someone else. And when we bring all these together, we often refer to these as total communication methods. So when we're using all of these different approaches, we often refer to them as total communication. And we can think about those both as the communicator in terms of the expressor of information, but also the receiver of information. So both parties can use all of these different methods to communicate with each other. In terms of then reasons to communicate, there's lots of reasons why we might communicate with other people. And this is important for us to think about when we then think about opportunities and providing opportunities to communicate. So we might communicate to share what we need or how we feel about something. We might communicate to give an opinion about something or to make a decision. It might be that we communicate to ask a question or indeed to answer a question. But also we often communicate just to be sociable. So very often I speak to my mum every single day, often more than once. And often my husband will say, oh, what were you chatting about? And I'll be like, this and that, because actually the content of that conversation doesn't matter. It's just that we're touching base, it's just that we're making contact with each other. So often that reason for communication is just to be sociable, just to exchange some information with somebody else. So lots of different reasons why we might communicate. And so we need to provide opportunities for people to communicate with us, particularly if someone is struggling with their communication. And we can provide those opportunities by giving or taking time, by asking someone questions, so inviting someone to contribute in a conversation, but also by seeing people. And by seeing people, I mean picking up on those non-verbal methods of communication. So recognizing when someone might want to join in, and valuing people's contributions. If you contribute something and someone values it and speaks positively about it, you're more likely to say more. You're more likely to want to join in more. So particularly if we're supporting someone with communication difficulties, we might want to think a little bit about how can we increase those opportunities for people to communicate? How can we help to provide those opportunities? Okay. So I'm going to move on to talk a little bit then about some of the communication difficulties that people might experience, and then how we might support people as well. So there are three categories that we might use to explain or to describe communication difficulties. So one of them might be expressing yourself. So that might be things like finding the right word to use, using the wrong word, so not the word that you intended to use, but it might also be things like repeating yourself, so forgetting that you've said something and saying something again. So those we might call expressive difficulties. People might also have difficulties understanding others. So this might be following what people are saying. It might be following instructions, but also remembering what someone has said as well. So it might be that you've understood it at the time, but you might not remember and retain what someone has said to you. And then we might also have what we might group as social interaction difficulties. So this might be losing your train of thought when you're having a conversation with someone that might impact then that conversation. It might be not being able to interrupt, or we sometimes call it interjecting. So if there's a group of people and there's a couple of people chatting, some people might find it hard to interrupt, to get into that conversation. But also some people might have difficulties thinking of what to talk about, so coming up with new topics. And certainly my nana, who lived with dementia, she, particularly when she went into a care home as her dementia progressed a bit, she often wouldn't be able to think of things to talk about. So she would always ask, how's work and have you got any holidays planned? Because she couldn't really think of any other topics. And so if there was a lull in conversation, she would automatically ask, how's work, or have you got any holidays planned? And if we didn't want to talk about that, it would be our job to bring up a new topic, because she really struggled to think of new things to talk about. In terms of then speech and language therapy role for communication, so if people are experiencing some of those difficulties, it might be helpful to ask for a referral to a speech and language therapist. And really similarly to when we come out for eating and drinking, we will always want to ask you about your preferences. So tell us a bit about yourself, the things that are important to you, how you spend your time. We'll ask you about your communication difficulties. We'll also want to do some kind of assessment, and sometimes that might be more formal assessment. So we might ask you some specific questions, but very often we'll just have a chat with you. And while we're chatting with you, our brains are whizzing all those things we learned at university, all those questions we're thinking about, how you're responding to us, what you're able to do well, and areas that you might be finding a bit more difficult. So we'll do that through having a chat with you, but also we might watch you having a conversation with a family member or a friend, or a member of staff if you're in a hospital or a care home. So we'll want to understand every day what your communication is like. We would always, with the person's permission, speak to families or supporters, so get some information about what they might find difficult, because communication is a two-way thing. So it's not just about me and my communication, it's about all of the people that I interact with. Are those people helping me with my communication, or actually are they doing things that make it more difficult for me? So it isn't just about the person, it's about what we call communication partners, the other people that person interacts with. And again, we would want to give you some really personalized advice and support. But as with eating and drinking, I've pulled together from our guidance some general things that can be helpful. So I've started off with some information for you yourself if you're a person who struggles with communication, and maybe you're getting stuck with finding your words or being able to express yourself. There's a few things that you can try. And I should say as well, I acknowledge it can be really, really frustrating when you can't get across what it is that you want to say. Anyone who experiences that can find it difficult, but if it happens frequently, it can be really frustrating. So when I say take a breath and slow down, I realize that that can be really hard to do if you're feeling quite anxious or frustrated about it. But just if you can try and slow things down a little bit, it can help you to just give your brain a bit of time to think about those words. If you can talk around the word or describe what you mean, you can often get your message across without having to use the word itself. So you might be able to talk around something instead. Using gestures or mimes can be helpful. So using those non-verbal communications, those non-words, or pointing to things or using objects to get across your message can be helpful. Sometimes if you just skip the word, but just keep talking, often it might come back to you, or you'll give enough information that the person can pick up what it is that you're trying to say. Sometimes a speech and language therapist might help you to put together like a memory book or a vocab book that can be really helpful. So it might be that you have a book of words or phrases that you use regularly that you can then look through and point to or read if that's helpful for you. And sometimes we just want to take a break and try again later. It's absolutely fine to say, do you know what? It's not coming. I'm just going to take some time out and come back to it. And also really important is to share with someone what helps and what doesn't help when you are stuck for a word. I remember a couple that I spent some time supporting, and the lady had dementia and she was supported by her husband, and she often struggled with her words, but she'd always been a very articulate lady. She used to be a head teacher of a secondary school. She was very well educated, and when she was at home, she agreed with her husband, when I'm at home, try and let me come up with the word for myself. So even if it takes me a while, I want to try and I want to struggle through it to try and get to the word. I'm okay with that. But if I'm in public, for example, we've gone out for lunch and we're at a restaurant and someone's come to take my order, you tell them what I want. Because I'm perfectly happy to struggle in my own home, but I don't want to struggle where I'm going to be embarrassed in front of other people. So it's really helpful if you can share with people, this is what helps and this is what doesn't. And some people will carry a little card with them that if, for example, they go to a shop, they might hand over to the person in the shop to say, I have communication problems. These are things that help. These are things that don't. So we can pass that information on. Okay. So that's for you yourself if you're stuck for a word. I've got two final slides that are just going to go through some tips for how families and friends might be able to support someone who has communication challenges. So as mentioned, linking on from the previous slide, agree what help is wanted and in what situations. So asking that person, is this helping or is this not helping? As with eating and drinking, that eye contact, being at the same level is really, really important to make that connection with that person. So try not to stand over somebody. Keep the pace slow and unhurried. So trying not to rush that person when they're trying to get their message across. Thinking about your own communication. So are you speaking clearly? Are you using your body language? Are you pointing to pictures and using that total communication approach? So think about adapting your own style. Listen carefully, and I've said with eyes and ears, because we pick up a lot of communication from what we see. And I remember my granddad used to say a lovely phrase, let me put my glasses on so I can hear you properly. And I think it's such a lovely phrase because we do take in so much through our eyes. So listening with your eyes as well as your ears to what that person is telling you. Knowing the person and their preferred topics of conversation is going to give you a head start as to what that person might be trying to talk about, and also what topics you could introduce if that person's struggling to come up with a topic as well. Avoiding testing the person with lots of questions. So sometimes we think about that use it or lose it approach. If we don't kind of test ourselves, will we lose that skill? But actually, if we ask lots of test questions to someone that, you know my name, don't you? You know what I'm called. If that person can't bring your name to mind, that's not going to be helpful for that person. So I mean, my nana was visually impaired as well. But I used to always, when I visited her, I'd always say, "Hi, Nana, it's Lindsay. I've come to visit." I've normally brought a dog with me because she loved dogs. She would be very cross if you went without a dog. So I'd say, "Hi, Nana, it's Lindsay. I've come to visit. I brought Seth with me, the dog, so that she knew who it was, so I could cue her in, because I knew sometimes she wouldn't be able to find my name or be able to remember who I was." A few other things then we might help to adapt the environment. So if we're trying to have a conversation, having the television blaring in the background might not be helpful. Or if we're wanting to talk about something important, being in a busy environment might not be helpful. So being somewhere quiet and familiar is going to make that easier for people. Sometimes we might want to engage with someone without using words. So if someone's really struggling with communication and having a chat with that person is quite difficult, it might be that we go for a walk together, or we might go and plant some flowers together, or look through a photo album together. So it doesn't have to be that we always have to use words to interact with someone. We can do activities that don't rely on words as well. If someone has hearing aids and glasses, we might want to support the use of that if that person needs them. So can we help with cleaning glasses? Can we help to check that the batteries are still in someone's hearing aids? Getting the person's attention before talking to them. So rather than just talking and that person might not realize you're talking to them, getting down to that person's level, making eye contact, getting that person's attention before we talk to them means they're in a good position to be able to hear and take in what we're saying. Always include the person. Really, really important that we don't talk about somebody when they're there as if they're not there, that we're actually including that person in that interaction. And if we need to have conversations about someone that might be distressing for them, we can do that in a different room. We shouldn't talk about people in their presence without including them. It isn't person-centered, and anyone would feel uncomfortable about that. Give the person time to talk and to process what has been said to them. For some people with dementia, it might take them much longer to process information. So giving that bit more information that bit more time for that person to process that information. Providing one piece of information or one subject at a time. So trying not to overload that person with lots of information. And finally, if someone says the wrong word, but you understand what that person means, you don't need to interrupt that person to correct them, because that might then stop that person from being able to continue with what they're saying. And I think anyone can use the wrong word sometimes, but if you understand what the person means, you can just let that conversation carry on. So want to try not to interrupt too often and break that flow of conversation. So that is a massive whistle-stop tour to some guidance that took us over a year to develop, with lots of consultation. But I hope it's given you, whetted your appetite a little bit as to what is in that guidance. That is the link again on the screen now. So the QR code for those who can use that. There's also the web address there. And as I say, we will include the web address in the recording as well. And please do go ahead and share the information with anyone who you think it might be helpful for. So I'm going to stop sharing now, and I think we have some time in case there are any questions.
Oh, that was amazing. Thank you, Lindsay. What a whistle stop of fantastic information. So, I've got a bit of a personal interest in this because my dad had dysphagia for the last 4 years of his life. So, it's always been a passion of mine, and I know it's something that a lot of people really struggle with, including professionals in care environments. It can often take a while to get a SALT assessment as well, because we know that there's a lot of demand on that system as well. So I think what you shared is amazing. And if Claire could pop the link in the chat again, please, for the guidance. just for anyone who's joined late. I saw lots of people coming and going, as is the way with these things. So I think a few things that just really jumped out at me. Everything you talked about preferences, the person, know the person, talk to the person. And I think that's just a huge takeaway for everybody. That's the starting point of all good care interactions, isn't it? You like 2 squeezes of your tea bag. I like at least 5, and probably leave it there for about 5 minutes. I want it really strong. So there you go. There's preferences in a nutshell. You did find me eating your yogurt as well, so well done on that. And all the stuff you talked about positioning and eye contact and all of that. I don't know if you're aware of McIntyre's 10 facilitation skills, but they are a fantastic little graphic that really sums that up, and I talk about that a lot because I work with them. So thank you, Lindsey. Just loved all of that, and you know I'm keen to have you back to reprise some of this. So let's go to the chat because we haven't got a huge amount of time. So Sue says, where and when will the video be shared? It will go on YouTube, as my colleague David has told you, and we normally get those up pretty quickly. David's a whiz with the tech, so that won't be a long wait. Lynn says, where can I buy some prompt boards or cards to help people living with dementia to communicate? What exactly should I be looking for, searching for online?
Yeah, so one of the resources that's used quite often is called Talking Mats, but you do need to do training to access those. So it's only really helpful for probably more healthcare professionals or people who have the funding or the resources to attend the training in Talking Mats. What I would say is to think about what is it that you're wanting that person to kind of communicate with that person about, because those prompt boards and cards can be really individualized. So for example, some people might benefit from having drawings, some people from photographs, some people having words on them. So that can vary from person to person, but also thinking about what vocabulary that person might want to communicate. So is it that I'm wanting to use prompt boards or cards to offer people choices, for example, around what they're eating and drinking? So could I just take pictures of the food and drink that that person has and enjoys, and use those, you know, print those out and put them in a book for that person to use? So there are some ready-made resources, but I would say the ones that I find most successful would be the ones that have been made bespoke for that individual or for a particular scenario, a particular kind of setting. So yes, that might be something to have a kind of think about. What is it that you want that? What is it that you're wanting to use it for, as to then what vocabulary might be useful as well. And also, speech and language therapists often will create those specifically for individuals as well.
Super, thank you, Lindsey. I've seen the options where we show people different meals, or we show different ingredients. Actually, would you like this? Would you like that? It's that visual. And you talked a lot about sensory, didn't you? About the ears and the eyes and everything working together to support the person. So I think that's really super advice. Okay, there's a shed load more of questions in the chat. We're not going to get to all of these, but I'm going to come to Mac. If Mac is living with dementia, he's a colleague, someone I work with. I'm going to have to ask you to be really quick, Mac, because I've probably got about 10 questions in the chat.
Yes, thank you. Yes, I just want to say that it was brilliant presentation by Lindsey herself. Absolutely, I can't fault it in any way. Just to add a little thing, you know, some of us are bilingual, and what happens is there are times when we think in a different language, and then that time lapse is sometimes misunderstood by the professionals. And I also believe that facial expressions, yes. Eye contact, yes. But knowing a little bit about custom and culture will also be beneficial, because in some cultures, nodding of the head means yes, and in some cultures, it means no. So little things, but I think it makes a difference in communication, and it needs to be interactive as well. Make the person involved. Thank you for listening.
So important, Mac. And actually, you very kindly made some videos for me that I use in some of my teaching. You made them with our lovely Claire Mason, who you know well. And actually, I shared that just last week on Friday, you talking about bilingualism and multilingualism, and that need to give that little bit extra time, and not assume that you're not going to respond, but give you that bit extra time. So thank you for highlighting that. Thanks, Mac. Really important. Oh, you're on mute, Beth.
Sorry. It's great to have you another one of our webinars, Mac. Thank you. Thank you for coming along and sharing that. A question from Anne. How can we influence a care home to address the food suggestions?
Oh, really interesting. Yeah, that can be a real challenge, because residential care settings, they have very, they have specific budgets, they have specific approaches around eating and drinking. I think being really clear in preferences, so having a very clear list of preferences of what someone does or doesn't like can be helpful, but really keeping those things up to date as well. Because our people's taste preferences can change. So I think influencing through giving feedback, using their channels of feedback. I'm not going to be able to give a fix-it answer, because there are so many challenges for care providers when they're trying to meet the needs of multiple people in a communal care setting. I think the other thing to be aware of that's really important is, as I say, recognizing that taste and preferences can change. And so working in collaboration with the care provider, because sometimes they might have noticed something that we as family members might not have noticed. So I think having those open conversations with care providers around, this is what's important for my family member or the person that I'm caring for, and being that advocate for that person. There's no easy answer for influencing that. I think it's just about that, giving that feedback and being that really strong advocate for somebody. But I recognise that can be really exhausting as well for family members.
Yeah, I would second that. And I would say, Anne, my dad was in care homes for 9 years. We had a lot of those challenges. In those last 4 years, when things got really tricky with Dad's eating and drinking and swallowing, in consultation with the SALT team, we would bring in some bespoke things for my dad. So, for example, fruit smoothies were a really great consistency for him, and we would buy those because the care home only provided squash and then thickened it, and he didn't like it. So there is sometimes, if you can afford to, it may involve also sort of trying to meet some of those sort of needs yourself. There has been some interesting work done by V for Life, Anne and Lindsey. I don't know if you're aware of that. Very much around supporting cultural preferences around food, and people who have vegetarian preferences, vegan preferences, and other quite specific diets that they really want to follow. So if that's something that your relative is sort of in that ballpark, and you might want to look at what they've done around that as well. Tracy says, do you have any recommendations for recipes for people with dysphagia? I've seen a book called Don't Give Me Eggs That Bounce, but it isn't available anywhere in the UK to buy.
Yeah, I think I've only seen copies at conferences where they happen to be there of that book. So can I recommend foods for people with dysphagia? Yes. What I would say is, I would really be looking at what adaptations that person needs and trying to make them as, I don't like to use the word normal, but everyday as possible. So things like if someone's struggling with crumbly biscuits, are they prepared to dunk them in their cup of tea to make them softer? Could I add more sauce to something to make it more moist, to make it easier for that person to manage? So I often think about and things like finger food. So can I think about having things that someone can eat with their hands a bit more easily as well? So I'm always thinking about, rather than having specific meals, thinking about what are this person's favorite meals, the things they really enjoy eating. And might it be that I might just have to make some adaptations to that? So if meat is too chewy, but actually they can manage vegetables and potatoes absolutely fine, might I make a mince to go with a meal? So something that's softer. Or might I cook something in the slow cooker so it's really nice and tender for that person? I don't eat meat, so I'm not very good at cooking meat. But thinking about that, what are that person's preferences? What are their favorites? And how might I adapt that? So that's the approach that I normally take, rather than thinking about dysphagia specific foods, because we want to be as the least restrictive as we possibly can be, because people get so much enjoyment from food and drink. We want to try and be as least restrictive as we can be, so only adapt those things that we really need to. So I think it's a case of having a look at what might a person be struggling with, and how might we adapt that bit while keeping the other things familiar for that person.
Super. Thank you so much, Lindsey. That's really useful. We are running out of time, but I'll see if I can get to a little bit more as well. So Alison says, lots of thank yous, by the way. The chat is full of thank yous to you. Alison says, thank you, Lindsey. Amazing session. If someone is getting frustrated because they can't communicate their message, what would be helpful to reduce frustration, e.g. try alternative methods or move on to a different topic?
Yeah, I think either of those would be good suggestions. So try other methods, move on to another topic. I think as well, one of the most important things is having empathy. And I've said to many people, I can see how frustrated you are about the fact I'm not understanding what you're saying, and I'm so sorry that you're feeling that way. And I think sometimes just acknowledging that frustration can help to reduce that frustration, just by naming it and acknowledging it. And I often put that, I'm so sorry that I'm not able to understand what you're trying to tell me, rather than you're not able to get across what you're trying to say, because sometimes that takes that pressure off that person, and it means I take some of that responsibility. So I think, yeah, sometimes moving on, trying a new topic, trying coming back to it later, but also using your knowledge of that person to try and understand what that person might be trying to tell you about, using some of those tips. I'm not quite getting the word that you mean, can you tell me a bit more about it? So those kind of prompts, those stuck for a word prompts, can help that person sometimes. But I think empathy is one of the biggest things that we can do to help relieve some of that frustration, that anxiety of just saying, I'm really sorry, I'm not understanding what you're saying, because I can see it's really important to you, can be enough to help that person feel seen and heard.
Thank you, Lindsey. We've run out of time. It's been amazing. There are so many lovely thank yous in the chat. They continue to flow in. I think people have found it really useful. When you're doing your feedback, everybody, if you have found this really useful, if you would like to have Lindsey back, I think she's willing to come back again. It wouldn't be this year because we're just about full for our webinar program this year, so it would be in 2026. Do let us know if that would be helpful. And also, when we were planning today, we very much talked about whether Lindsey would focus on eating and drinking or whether she would focus on communication. So if people have a particular preference for what they might like to hear about again in the future, then absolutely do pop that into the feedback for us. But just to say, Lindsey, from all of us, thank you so much for your time, your expertise. I'm absolutely certain you will have helped some people today to have a better communication, eating or drinking experience as a result of what you've shared. So thank you very much.
Thank you so much, Beth.
So just to share with everybody our next webinar, they are coming thick and fast. It is on the 8th of April and it is called Culturally Meaningful Engagement in Dementia Care. It's part of our ongoing commitments to our EDI work. Would love if you could join us. The links are in the chat. And there are upcoming webinars as well. We've got a community space coming up. We are going to be hearing from Dementia Carers Count and Tide about family carers. We're going to be looking at technology. We're going to be looking at hearing loss and dementia. Lots of important topics coming up. And also we're going to be looking at environments in July, which is something that Lindsey's talked about today with the University of Worcester. So there's lots of great stuff coming up and we look forward to seeing you on a webinar again soon. Thank you.